Today we have a case of granulosa cell tumor. The patient is a 27-year-old female, G0P0. She came in with an acute complaint of abdominal pain. She also has a history significant for morbid obesity and polycystic ovarian syndrome. On examination, she was felt to have a left-sided large abdominal mass. Laboratory studies revealed an elevated inhibin A of 360 and an elevated inhibin B of 6,880. The patient was then sent for transabdominal and transvaginal ultrasound. These are the images. On the first image, we are looking at transvaginal imaging, sagittal view of the uterus. Here we see a significantly thickened endometrial lining that also has a cystic appearance. On this second image, we are looking at a transabdominal image of the left adnexa. Here we see a large left adnexal mass that has cystic and solid components. No normal left ovary is seen separate from this structure. Based on these findings, the patient was counseled and was taken to the operating room, where she had an endometrial curettage, in addition to removal of her left ovary and fallopian tube, along with washings, biopsies of the pelvic cavity, in addition to omental biopsies. Pathology results showed endometrium had hyperplasia without atypia. The left ovary was significant for a granulosa cell tumor. Pelvic washings and biopsies were all negative. The patient recovered well after surgery. She is now currently being followed in good condition with inhibin and CA-125 levels. She does not require any adjuvant therapy. Ovarian granulosa cell tumors are a rare type of ovarian cancer known as sex cord stromal tumors. They represent about 2 to 5% of all ovarian tumors. Granulosa cell tumors most commonly present with abdominal pain and a pelvic mass on physical examination. Surgery is a mainstay of initial management to make a histologic diagnosis along with staging and debulking. Total abdominal hysterectomy with bilateral salpingo-oophorectomy is a correct surgery for women with advanced disease or are done with their reproductive years. A conservative unilateral salpingo-oophorectomy can be done in patients with stage 1 disease and patients of reproductive age, such as in the case presented today. The most important prognostic factor associated with recurrence risk is the stage of disease at the time of diagnosis. In patients with advanced, recurrent, or metastatic disease, chemo is the treatment of choice. Prolonged surveillance is required as tumors tend to recur years after initial diagnosis.